How can we expand and enhance healthcare throughout our communities? Find out on Talking with Henrietta, coming up next. Hi, I'm Henrietta. Welcome to the show. On previous shows, we talked about the health disparities that exist in our communities. But did you know that each ethnic community has its own health challenges? On this show, I'll talk with 3 people in the health field who will describe what some of these health challenges are, how they show up in each community, how they're being addressed now, and what can be done in the future. Dr. Sandra Escobar is seated to my left. Dr. Escobar is the Clinical Director of Integrated Behavioral Health Services at the Ravenswood Family Health Center in East Palo Alto. She has held several leadership and clinical positions working in community behavioral health programs, serving the neediest and most disadvantaged individuals in our communities. She currently provides clinical oversight for the Integrated Behavioral Health Services Department, as well as direct psychological services to the community. Albert Arias, seated to my right, is a community health advocate and supervisor with San Mateo County Health System's Health Coverage Unit. He has worked for San Mateo County for 14 years to conduct outreach in the community and to assist local families enroll in and retain health coverage. Seated to my far right is Dr. J. Africa. Dr. Africa has served for 11 years as the director of the Office of Diversity and Equity for the San Mateo County Health System's Behavioral Health and Recovery Services. He helped create the Office of Diversity and Equity, and he was instrumental in promoting initiatives that address different culturally focused disparities. These initiatives include the Latino Collaborative, the Filipino Mental Health Initiative, initiatives for the African American, the Pacific Islander, and the Native American communities, as well as the Pride Initiative, focused on LGBTQ issues. Well, thank you so very much. I can't think of having more informed guests on the subject. So let's start from the beginning to make sure we and our audience, our viewing audience, are on the same level. So in the beginning, when we talk about health disparities, what are we talking about?
We're talking about certain groups that do not have access to the same services that perhaps some other groups have access to. I know that in the community where I'm providing services, the Latino community has many barriers, including language barriers, to getting access to mental health services or behavioral health.
So why should there be so many problems having access to health care?
I mean, I think there are many factors to consider. If I can also talk more about disparities, I think for me, my understanding of that is that people's health situation or health status look very differently depending on your age, your gender identity, your race and ethnicity, the places that you live. So we talk about why is there such differences given those categories. And I think that can be for many different reasons. You talk about challenges with access, the resources to get healthcare services. What kinds of services are available, for example. Many of our, for example, communities speak languages other than English, and the service provision or how we provide services mostly are in English. There's fear of seeking services. It costs money to seek services. All of those things, I think, are factors that create problems in access. And some of our services, some of our systems are really hard to navigate. You sign forms you probably don't understand. You have to talk to multiple providers, and navigating that can oftentimes be difficult.
Sure. Now, Dr. Escobar, Dr. Africa just now talked about fear of getting services. Is there a fear? Do you run into that with the patients that you see?
Absolutely, and I'm seeing that more and more as I provide direct care to the patients. The fear of, particular with a recent issue with DACA, immigration, there's great fear for that. You have people, I've seen patients that perhaps are dealing with domestic violence. They're afraid of being deported, if you will, if they were to bring some of these concerns and address some of their mental health issues. So that absolutely there is a fear in the community.
But East Palo Alto is more or less like a sanctuary city where people can feel free to report, let's say, domestic abuse or something going on in the neighborhood without fear of triggering an ICE investigation.
You're correct. And what I am seeing is that for so many years that wasn't the case, so people are still very afraid. And I think as different news comes from Sacramento, people begin wondering, is this really, can I really trust, even though you're right, that there is a sanctuary, we provide services, whoever needs those services regardless.
And that's information that's communicated to the clients that you see?
I believe so, yeah.
Oh, okay.
Yeah.
So that might allay some of their fears.
Yes.
Or is it that they still might not trust, but it is that they might hear?
I think so. It's very complicated because sometimes they might hear stories from other places, other states and other counties. It might not be the case as, the sanctuary that we might have here. So they feel, okay, well, if that happens to them, that might happen to me. So we are battling a lot of different, areas of what's discussed in other places besides in East Palo Alto.
Sure,
If that makes sense.
There's a lot of misinformation out there, as Dr. Escobar said. What they hear on the news, what they hear from other people, rumors get passed around, and I think that sort of is happening around many of our communities. And just again, there's a lot of misinformation out there.
Sure. Now, when you do outreach activities to tell people about coverage, do you run into suspicions? Or?
Yeah, definitely. You get a sense from the community that they're like, I saw this on the news. There's been a raid, in San Jose. There's been a raid in San Francisco. What about here in San Mateo County? Am I safe? Am I really safe? Is my information going to be, given out because I'm saying, hey, I'm undocumented, and I'm looking for services. So part of the health coverage unit's goal is to, assist people to help them with enrollment, help them navigate the health system, and retain that. We do our best to educate our clients and let them know that none of the information that we hold or that we ask about is shared with other agencies.
No, it's easy. It's one thing to hear somebody say that. And given the threat that they might feel, the people that you deal with, what do you have to do anything extra to get them to believe you?
No, with me working 14 years within the county, we started with the Healthy Kids initiative, and now it's up on the state level where all children, regardless of their immigration status, can, it also depends on your financial status, your income, but would qualify for no-cost Medi-Cal. So we've established relationships with our communities throughout San Mateo County, and the feeling I get with clients coming in, they know us, they've seen us for such a long time, and that to them is deep to them. You know, if another agency were to come out or a new person comes, there's like, well, you know what? I was helped by Alberto. Can I talk to them? So these are the strong relationships that we've built already that HCU has, you know, focused on and is proud to be a part of this community.
So, and there's no fear that the government might come in anyway and ask for access to your files?
I mean, I think that fear is always there. I think what Alberto said about, you know, us being seen and being familiar with the communities and the situations, and people have known him, for example, and some of our staff have been in the communities doing outreach, talking to them. We go to churches, we go to schools, in places that normally we would not. And when you see a person doing this work for a long time, it feels like family to them. And I think for many of the communities that we work with, that fear of like your government goes a little bit away because they feel like they can talk to you, they've seen you around. And I think that really makes a difference. I mean, the stigma also of seeking services has always been, I think, a problem that we all see. And maybe more in behavioral health, mental health, and substance abuse.
What is the stigma? How would you define the stigma in seeking services? Is there a stigma, mental health services, a stigma in seeking other services?
Yes, I mean, mental health services. In many of the populations that I work with, the Latino population, it's been a stigma back in some other homes, and it continues to be here. It is viewed as something that it's weak, that you're supposed to handle on your own, that is not, you know, to bring it to other people outside your home. This is a family matter. So that really is still very prevalent.
That's a stigma in terms of seeking mental health services. What about other health services?
There's a cost. For many communities, just seeking help in itself is a sign of failure, right? So they, at least in some, you know, I'm Filipino, I grew up, and I know some of the community that even when they're in dire straits, they don't want to ask for public assistance, for example, because it's embarrassing for them. So when
but
you
not going to get the help.
But not going
just
admitting that
the
there's something,
financial assistance.
the financial assistance. But also some folks just don't want to go seek physical health services, you know, because it's a sign of weakness. Not just.
But if you're sick, is being sick, I mean, is having a cold that lasts for several days or a cough that lasts for a week, is that a sign of?
For some people it is.
Well, if you can't cure it, doesn't it make sense to get medical attention? But then I didn't grow up in a culture, so it might be hard to understand.
Yes, I think one of the things that happens too is in many of our cultures, I know in my culture, you go first with your home remedies. You go homes with what you've grew up thinking that that's going to help you, and so you try that both for medical and mental health, and so it's a sense of pride. Or you know what, this was passed down from my great grandmother, grandma, and so you know I'm going to try this. It's good. It's been in generations. It worked for them, so it should work for me. So I think there's a sense of also the tradition and pride.
I do that too. Try the home remedies, or look up a few home remedies. But then if that doesn't work, then it's okay. But it's not okay for in some cultures.
I think there's a hierarchy of how quick you'll seek services. So maybe in the beginning, I remember my dad saying, stomachache, no, go away in a little bit. So when it's been a few, then you can say there's much more permission to say seek medical help. And then it sort of the stigma remains for mental health issues and substance abuse issues, because physical health, there is a actual physical problem. But there's, I think, a hierarchy of like when you go to seek help.
Excuse me.
No.
It's almost a sense of urgency.
Yeah.
You know, we see different populations. There's an immediate sense of urgency. Something happens, a cold, I need to go see the physician. And in some of the populations that we do see, it's a matter of we'll wait to the last minute to figure out if what I do, it works. If not, I go. So then you end up seeing, at least in my experience, you end up seeing people, patients, in crisis situations,
Who
both
might be
medical
critically
and
ill
mental. Yes,
because
correct.
they waited so long.
Exactly. And also, the fear of what might be wrong with them and what would that entail.
And of course, the longer you wait, the greater the chances that whatever it is you finally decided to seek help for has advanced. Now, I had mentioned that each community might have specific challenges. And since you all work with a variety of different communities, could you go into a little bit of detail on how some of those challenges might vary from between different communities?
So, I mean, it's sort of easy to say what are commonalities, but I fear like when we talk about that, it stereotypes different communities. We know, though, that generally people's help-seeking behavior is dependent on the culture that they grow up in. So if it's a practice that, for example, because I'm in behavioral health, so there is a hierarchy that it's much okay to seek physical or medical services than mental health. So our understanding of what is involved when somebody has a mental health condition might seem different than people say, oh, it's just mental, it's something that you think in your head. So people probably will say, if you believe that, then you probably will not go to seek help.
Well, I think that might be something that might hold in regular mainstream culture too. Just the idea, we're still finding or accepting the idea that if there are some mental conditions, it's okay to recognize that there is a mental condition going on and to seek help for it. So even in mainstream culture.
And I think that has a lot to do with sort of the images that we see about people who have mental health conditions. I mean, all the news that's sort of happening in violence, for example, what is the picture in your mind when you hear mental illness or mental health conditions? And I don't think that's always correct. So we need to change that. So you're right, even in the mainstream ones. But for many cultures, for example, that have a different belief of what mental health is, and they come here and like, I don't understand that, then it's really about educating them about how serious that matter can be, that prevention is important, that seeking services is really important, that it's really about health. When we talk about health, it's really a holistic picture of what health is. And part of that is mental health, spiritual health, financial health, medical health, or physical services, right? So all of those things are really intertwined.
Are those intertwined, Alberto, when you talk to people in terms of signing them up for health coverage?
I believe so. More so with us, you hear that they have financial hardships. Some people, which is kind of heartbreaking because they end up waiting for such a long time, and we're talking about stigma. They wait so long and that to the point where they're really, really sick, and they end up in the ER. Not only are they having to now worry about their health issues, now they have to worry about their financial issues because they didn't have health insurance, right? And they're coming into our office sick, having to fill out paperwork. And I always tell them, this is the worst time to get health insurance when you're sick. And we always try to promote, hey, get health insurance ahead of time. You don't want to be sitting here with me right now that you don't feel good. I wouldn't, So the thought for them, or what we present to them is, getting here before anything happens. As it is part of the law under the Affordable Care Act. It's the land of the law, the law of the land, and for people who continue doing that, I mean, sometimes I'm just like, it's kind of like a vicious cycle sometimes that I see happening, and people just say, you know what, I'm just gonna wait until I get really, really, really sick, and then I'll go, when they could have focused on that malady right then and there, and maybe avoided some other things, with a regular doctor's checkup.
How do you talk about when you talk to people? Now, I assume this isn't talking to people in the hospital itself.
So we have different outposts. One at the San Mateo Medical Center, definitely where we see patients coming in from the emergency department, the psych, people just coming in general from all over the county. We see all kinds of people coming in.
When you treat people, in terms of in behavioral health, integrated behavioral health, what are some of the right now most common concerns that you run into?
Well, first, and it's really important to mention this because this is related to what we've been talking about. One of the things that I do see now, which is very hopeful, is that they do come in through the medical concerns. And as we work with the physicians, we are able to address that holistic approach with a patient and introduce the health of, the mental health, the other components of their life, spirituality, their function in the community. And I think when I'm finding that when I go in and I introduce that as they're speaking to their physician, they're more open to look at all those areas in their lives. And I think, and then your question was related to
the common problems.
Problems.
However, before you get there, since you just now brought up this holistic approach, is this something new in medicine, taking a holistic approach?
I think that's always been the idea of having a more holistic approach, but I think it's been till recently that we really realized, we've finally understood how to do this, because the question of how to do it has always been challenging, due to different regulations and funding. But as we move along and find these ways of really integrating that, and all the health concerns of a person, nutrition, mental health, spirituality, all that, it is truly, I think it's a game changer.
Well, I'd like to just, before going to the original question, I'd just like to stick with that for a moment, the idea of integrated health, because you had that with a general practitioner, perhaps, but we don't generally have general practitioners now. They're specialists, and when you go to the hospital, you go for eye, ear, nose, and throat, or you go for your physician who will maybe check your blood pressure and give you a general checkup or workup, and then recommend you to specific specialists. So the idea of integrated health, I'd like to get your ideas on just how that's now working.
So when for me, my understanding of integrated health is your provider sort of is aware of all of the sort of things in your life that's related to your health, and that that person really sort of knows what's sort of happening with you and can refer you when you need to go to a specialty specialist, for example. I think what we've seen, though, is because our healthcare is fragmented, that you go to multiple providers. And sometimes you have to drive to different locations. So when people, for example, we know that people, we see over the years, there are folks that have a physical health problem, has a co-occurring mental health problem, and also has a co-occurring substance abuse problem, and they have to go through three different places. Provider will say, that's not my specialty, so before I can see you, you should go to this person or this person. And I don't show up one day saying, I have a substance abuse is a primary issue to me today, and tomorrow it'll be my ulcer.
Yes.
So that for me is the integration.
Yes.
Is like it's
Yes.
all housed in one area, so that it's more accessible to the person. We don't think about having to move to different location, and the resources are actually accessible. So that's what I think about integration. And especially we've seen that in behavioral health, because historically it's really separate that.
Yes.
Our mental health folks said, well, you have a substance abuse problem, I can't see you until that's resolved. Or the substance abuse problem say, I can't see you until your mental health issues are resolved. But again, we come to see providers, all of these things, and sometimes I'm homeless, I have a primary care issue, so all of that. So the burden of having our patients to go to multiple and navigate multiple systems can be really problematic and can turn people off. So that for me is the understanding of what integration is. And also that our providers really know that it's not just about physical health, that knowing about the circumstances where we live, right? Our financial health. Is there a supportive family or a supportive group or community that can support you? Because you might feel good within seeing a provider, but when you go out there, you live in places that, you're afraid to go out.
Yes, that's true. Now, I can certainly, I think it's commendable, this idea of integrated healthcare. But how does that start? I mean, you go off to your physician and you talk about a specific problem, right? It puts a lot of onus, it would seem to me, on that physician to do all of the things that you're talking about. Since many physicians are trained as, what, specialists in one particular area? So are they expected to ask you all of these questions that might involve your nutrition, that might involve the problems going on in your life, that might involve the specific problem that you came in with?
I am in a very, very unique, very fortunate situation with Ravenswood. We do in-house. We have many of the providers, and I have so the physician does ask all those questions, believe it or not, and then they will ask some other providers to kind of join in, being one, let's say myself. And I can be in the session with them,
With the patient?
With the patient.
So the
and
patient
the physician
then goes to see one doctor and ends up with others, a team?
To assess.
Is that something that's comfortable? I'm thinking if you're a very private person, all of a sudden you're sitting in a room with 3 or 4 people.
You know, so far in my experience, I have found it's the introduction to it. So the physicians our physicians are very sensitive about introducing. You know what? I think your diabetes it'd be helpful if we do 1, 2, and 3. You know, we look at your stress, we look at your nutrition, we look at exercise, and the way that they present it. And then while the patient is there, then like I get a call or some other provider gets a call, and then we as a team, you know, we be able to talk to the person. Or individually, I can remove that person from the room and say, you want to discuss this other areas, but it's all in-house. So like, you know, like we were discussing earlier, it's not that we're sending this person in other systems when the systems are very complicated as it is. And then you have people that perhaps don't even know, in my experience, some of the patients that I have might not even know how to read or write. And then we're asking them to navigate something that is just very complex. So in many of the cases that I am familiar with, the patient actually feels well taken care of.
Oh, okay, interesting.
You know, so more
Now,
engaged in the process.
Yes, I haven't forgotten that original question. Okay. However, I will ask before getting back to that. The initiative, you know, I had mentioned that you were instrumental in setting up various initiatives for the Latino community, the Latino Collaborative, the Filipino Mental Health Initiative, and then initiatives for African Americans, Pacific Islanders, Native Americans, Chinese, the LGBTQ.
LGBTQ.
Yes.
It's a mouthful.
How do you get involved in establishing these different initiatives? And why?
Was a recognition that I think our own values and beliefs shape the way we behave, right? So I said our understanding of an illness or something that happens to us dictates how we're going to respond to it. And we know that in many of the communities that we serve, I mean, San Mateo County is very diverse. And you just hear, you know, communities have sort of an understanding of their illness. And over the years, we noticed that how Pacific Islanders speak about mental health issues might really be a little bit different than how Filipinos speak about mental health. And so if we use the same approach, those approaches might not work for each other because maybe thinking about depression doesn't happen. One common notion that we hear, like African American men, there's no depression there. So we need to think about how do we, you know, talk to African American men about depression in a way that is aligned with their culture. That might look differently than Pacific Islanders, right? So I think that understanding, and we have had programs that we've done, but when we try to implement it in different communities, it doesn't work. So we try to really understand, well, what's different? What are the cultural nuances? What's the messaging that might look differently?
And whom do you go to to give you that?
We go to the community. We go to places geographically. We talk to people about that. We talk to faith-based communities. We talk to community leaders. We go family members. We talk to organizations that deal a lot and talk to these different communities. And
So let's take an example. You mentioned African American men and depression. There's no depression. How do you then get to the roots of somebody who's African American who might feel depressed?
So, I mean, there's a lot of literature that's about studies, with African American, and you look at community-based organizations that work significantly with African American communities, and maybe have conversations about them, and also hear patients and clients and their stories. That's sort of how you do. And good clinicians, good providers ask, well, what you're feeling, you don't necessarily have to call it depression, but they come up with words to explain it. And so you pay attention to the words that they use.
Can you give us some specific examples?
So in the Filipino community, for example, the concept of hearing voices, right, is about, and actually not just the Filipino community, in some Asian community, hearing voices could be voices from an ancestor, right? And here in the Western culture, we talk about that's sometimes mostly psychosis.
Yeah,
right?
schizophrenia.
Yeah, schizophrenia. But in some cultures, really, it's saying, it's about hearing like a voice from, a family member that had passed away. And to judge quickly that that's really diagnostic, that there's a mental illness, doesn't take into account, well, what's the understanding of that? There might be some psychosis, but what could be really a relevant understanding so that I can help figure out a way to help this person continue to live and function well, even with that understanding.
So could you give us, I'm going just a little bit
Yeah.
deeper because I'd like to know in terms of hearing voices, how that could be interpreted other than something going on. Now I can understand if you're in a meditation and you get some insights.
And again, it's different. I just can talk about the community that I grew up with, and there are folks that start hearing voices. I mean, I remember a family that I worked with a long time ago. I don't do this in the county. I don't have a clinical practice here, but a family, for example, that said, I think I'm feeling all of these depression, anxiety is because of something that I didn't do when my parents passed away, and this constant rethinking about. Failure is really, I think, either I heard it in a dream or somebody's talking to me, and really try to understand what that meant, that I needed to do something to repair that. So instead of giving somebody just a medication, really saying, like, let's help understand in your culture what that means, right? And so one of the intervention that we heard for that particular family is they did a ritual of like letting go of a family member that they actually never had the chance to say goodbye. And they had their whole, whatever family ritual they did. And then at the same time that they were going through that, to say, it's also good to see that there might be something else going on with you. So opening that door of understanding and affirming their own cultural belief, and at the same time saying, there are other providers that might be able to help you in the other aspects of that condition.
Well, I can think even in mainstream culture, how there might be a lot of people who can feel a certain anxiety because they had a relative who passed away and there was some unfinished business. And so that's the commonality, and maybe a lot of people could be using some of those rituals that might be helpful. Now back to that question.
I knew you were coming.
Oh, of course.
She didn't forget.
But I forgot the question.
And now everybody will be remembering there's that question.
There's that question.
In terms of the Latino community, some or not necessarily Latino community, but some of the common stresses right now, what is there because of some of the changes in the administration, in the American government, that there might be more stresses or anxieties, or what's coming up for people, many of the people that you treat now?
I have seen more people coming in with anxiety, post-traumatic stress. You have individuals that have already been, in very stressful situations, or what we call PTSD in some of their countries, or even here. And just the fear of not knowing what is going to happen, what their future might look like. It just brings a lot of that back, and not knowing, next steps. So I do find a lot of people that are really have an increase in anxiety. Much more, there's depression still going on, but I do see more anxiety right now, more fearful reactions, a little bit more what we call in the field paranoia, that something, which it makes sense, that something is going to happen and I have to be careful and watch out. And so that's what I'm experiencing.
Well, I'm thinking if you're an undocumented person, that would certainly be a very big concern.
Exactly.
And so you have that coming up a lot within your clients.
Exactly, yeah.
Do you have a level of anxiety or other stresses or other concerns coming up with those who aren't undocumented?
One of the things that I have seen, the documented people that do have their documents, some of the things that we're also seeing, that I'm seeing in particular, is also the economy, the local economy, that unable to be able to provide for their kids, or pay for rents, or find a bigger place. And so I have families that are documented or not documented, Latino or non-Latino, that are just having a difficult time trying to, find better jobs, better opportunities. I have families that have decided to leave the county and go to some other counties where it's the housing is more affordable. So those are the other stressors that come up for the families that we're seeing.
I heard about a survey today that 27% of the residents in San Mateo County and Santa Clara County are, what is it, food?
Insecure?
Yes.
Food insecure.
Food insecure.
So that means that they're really uncertain about where to get the food or how to put food on their table. And that's a basic need. Like eating and having healthy food really helps shape your whole health.
Yes.
And so if you don't know how you're going to pay for to have good nutritious food on your table with your family, then that's a stressor.
And that was a Second Harvest Food Bank survey. And in hearing about it, I think I was told that they are now feeding 250,000 people.
Wow.
I think per month, each month. And certainly, a lack of money causes a lot of stresses. And those are the main clientele that you have, those who lack money.
We serve low-income family through, some Medi-Cal.
Right.
So low-income folks usually. So that because the county is the safety net, right? So the folks that don't have as much resources come to the county. We have an obligation to provide the services to our residents that are low income and need the services the most.
So I'm thinking now with the tax bill and some of the tax cuts that there might be some changes made in the resources that might be available. That's not something that you're involved in right now.
No, I think it's changing so fast that I think it's hard to keep up. But I don't think I can talk more about that. But we know that's going to make a difference because it'll influence the resources. But it's changing so fast that we're all I think in waiting what's going to happen.
Definitely. But I do want to say that the housing and the food is a major stressor in our families and our community. We definitely we have providers in our site that are constantly helping families connect to those resources. So.
Well, it seems very ironic in Silicon Valley where there is so much wealth that you have growing numbers of people, more and more, who need those resources.
Yes.
So let's talk about some of the resources, what the resources are that are available. And when you do outreach, Alberto, in terms of letting people know that there's insurance that's available to them, what kind of insurance? And
Right. So
how can they get access to it?
Right. So we sit down with the community and we pretty much do a thorough interview. We let them know that there's
These are individual people.
individual people that come into our offices looking for health coverage. We explain to them the different programs that are available locally and statewide, such as Medi-Cal and Covered California. We explain to them the process of getting on these programs, what we need from them in order to qualify for these programs. And also we do look at them not only on we focus on healthcare, but we also hear them out, because this is a moment where they might tell us, hey, you know, we're really lacking in food, you know. Housing is getting out of control. They're going to kick us out. So we try to connect them with different resources. Again, you mentioned Second Harvest. We partner with them. They're at the San Mateo Medical Center and some of our other clinics throughout San Mateo County. And they partner with us in trying to get people signed up to CalFresh. Not only Medi-Cal, but CalFresh or other programs such as CalWorks, which is kind of like a bundle of services within the county. So,
And what is it, CalWorks? What does it
Well,
stand for? And
CalWorks, I don't do CalWorks necessarily, but it's through the Human Services Agency. My understanding of it is that it includes, you know, the Medi-Cal portion, the health insurance portion, the CalFresh portion for food. I believe it has some financial assistance in there. So it's kind of like a bundle that you would get all together, just because, you know, you might need, like we mentioned, you know, housing, food, healthcare.
And what do you do in terms of housing?
So housing, there's the housing authority that we refer to people. There's HIP housing, other agencies within the county that have that kind of gear towards this, I guess, issue that we're facing in San Mateo County. So we kind of just refer out and partner with them.
So the most referrals would be for medical help, for housing, for food. Are there some other areas?
Yeah, I mean, those are the top, basically, I mean, you talked about domestic abuse, right?
Yes.
Just, or maybe immigration questions that we have, or just in general, anything that, because this is the moment that people kind of open up about their lives, you know, and they might be, just recently, I just had a client, you know, just talking to me about how she moved over to the United States because she was having some domestic violence issue going, and she had feared for her life. I connected her with different resources, and I asked her, I go, is it okay for me to help you out? And, you know, she wasn't too comfortable because this is the first time she met me. You know, she's new to the country. I'm a complete stranger to her, but she needs this kind of help, you know, insurance help. But she opened up enough that she let me know, hey, there's other things in my life that are going on, and is there anything that you can do?
Sure. Now, Dr. Africa, you once sat on the Commission on the Status of Women.
A long time ago, and now I just am ending being part of the commission, the LGBTQ commission.
Sure. Now, I'm just thinking, what did you do on that commission that might be applicable to what it is you're doing now with different groups?
So one of the things that I really learned being on the commission was to really understand, again, sort of the approaches to different communities are look differently. Women still, you know, we're just thinking about sort of the situations of women and equity, for example. We raise the issues, for example, that women are still facing, that they still make less than a man's dollar, for example. They get like, what, 75 cents. So the issues that women face, and why it's really important to talk about that and give. So it's raising the awareness to the county that these issues really need to be looked at and align it to people's values. And also recognition of what the contributions of women have been in the county of San Mateo. So I think that's also what we want to do, and bring families and communities together and women together to talk about what we can do better to improve not just women's lives, but families' lives. Right? So that's what we did.
Well, as I talk to you, I can think of all of the issues that you're currently dealing with that are issues throughout our society. And I'm just thinking, do you see things getting better? Do you see areas that might be getting worse in people's lives? Are you finding more and more people that you see who are dealing with some of the issues that we talk about, a growing population of people? Or is that population getting less? What do you see in terms of trends? Are there any?
Like I mentioned earlier, what I do see is a great, and correct me if I'm wrong, a great effort to collaborate in different systems, collaborate more to be able to help some of the community that need our help, and that's something that I hadn't seen for a while. So it's really encouraging to find that different realms in different organizations are really trying to make this work and trying to see this, like I said, collaborate in the services and the needs of our community.
Well, I would think, just that word collaborate, I would think some people might think when you set up certain initiatives for certain ethnicities, that you would be separating and dividing people rather than bringing them together and having each of them looking inward at their own group and at their own concerns rather than looking at things from a general perspective. What would you say to that?
Well, there's actually we've heard that before. I mean, when we started, these really racial and ethnic cultural initiatives, people had said, well, why are we, separating them out? And we know that many of these communities have been invisible and that their needs have really been generalized. And so this is an attempt to really understand from their perspective what works for them, what can we do to make their situation or health outcomes better. But they're also bringing and aligning that some of these issues really are general, that they can all work on together. So in addition to just separating them out, I think their validation and the recognition that how we understand what the problems and the solutions might look differently, but that we are all in this together. And so as we talk about these issues, we bring them together and say, what the Latino talks about, stigma and challenge navigating or accessing services, Filipinos also, or Tongans, and how do we address that more? As a system, as an infrastructure, but at the same time, I want to be seen as who I am and what I bring, and that's why it's important. And what we know, though, if you treat everybody with the one-size-fits-all, it doesn't always work with
everybody is
where it's the same thing.
Where it's a melting pot, and we're all one, and we're all together, and this way of separating it out
is a good recognition of what you bring, what your culture, what your values are. And at the same time...
And the idea that it can all work within the American culture and the American value systems. And also it's a way of, I guess, merging value systems. When you have different values and you can bring them together, it makes it better.
But there's also a recognition, if I can say, that talking about the Asian Pacific Islander, that we thought that we lumped the Asian Pacific Islanders together, and so we use one solution to a problem, and we know, the dialects, the languages in itself is so diverse, right? So how can you use one solution to that diverse of a group?
So you were also instrumental with Native Americans. What would you say in terms of that community?
So we know, though, because of the historical trauma that that community has faced, that trauma and alcoholism is rampant in that community. So paying attention to how we address the trauma that they continue to face, and maybe paying attention to values that aligns, the values that aligns with how we talk about wellness and recovery, right? So we know, for example, that connecting to nature, some of the interventions that we think about might be aligned with their culture. So it can't be just all of a sudden it's medication. It might be really understanding. For some tribes, some communities feel like there's a disconnect between nature, right? So really aligning how they see it versus just introducing medication or seeing a counselor. Like why would I trust somebody who I don't know?
Is this something that's widespread, or is this something that's kind of localized that you're hoping will be more and more widespread? And I'm thinking, does it depend on your perceptions of, for example, because of past treatments, there's alcoholism now. The idea that there might be some heritage post-traumatic stress syndrome that's carried down from generation to generation. Is this something that's being accepted?
I think there's a recognition that that is happening. And we as health systems try to constantly think about how we address that, right? So it's through education, it's the coordination of services, it's the collaboration, it's really working with community to say, what has worked before? You know, what can be things that we can learn from maybe some of your practices that have helped, and also make sure that it's maybe aligned with the, what I would say, the Western ways of understanding health, right?
Is this just a California thing? You know, that sometimes the rest of the states look at California as, we'd like to think of it as being on the cutting edge, but there are other communities that might think of, oh, they're way far out there, the fruits and the nuts.
Yeah.
I think we're seeing that across the country. I think the extent of that looks differently. I'm sure, at least I know in this county we are really looking at ways to serve our residents as best as we can. So we are trying to be creative, proactive, collaborative, to really think about, bring our minds together and work with the community to say, what are the other things that we need to do, right, to make it work for you. As we look at what's happening in this country, of like what are best practices in other states or other places. And we try it, and we say, well, that worked, that can fit locally, and sometimes it doesn't, right? So I think it's a constant just checking, but a strong commitment by the County of San Mateo to its residents to provide the best care and the quality of services.
Alberto, are these any of the issues that you run into as you outreach in the community?
You know, when we sit and interview a family, we don't often get that deep with the families. They mostly go there and apply for health insurance, and they just either been through the emergency department. They've had a bill, you know, that they're looking for, you know, to get covered. So it's more of physical health and financial assistance. But in terms of these other disparities that we're talking about, we don't really go that deep with the clients. And from my experience, I haven't at least received any kind of information from them that says, hey, you know, this is what's going on with me on this kind of a level. Yeah.
So what can we expect, do you think? Are you hopeful?
I'm very hopeful.
Why?
I'm very hopeful because, you know, when I started in this field many years ago, and now I see the differences in terms of what we have done, and I know we have ways more to do and ways and many issues to address. But like I said before, just the idea of integrating services and finding ways to integrate service, integrate systems, being innovative about the different groups with different needs, and at the same time, you know, bring them together. All that, those are conversations that go on at the state level and at least in some of the meetings that I've been involved in, some of the conferences I've been involved. So it's really nice to see that, and also, you know, really talk about very difficult issues.
When you talk about at the state level, at medical departments at the state level, or where at the state level?
For me, it would be more of a behavioral health, you know, state organizations where we talk about, you know, advocating for different needs for behavioral health. You know, that's my area. So those are things that I'm more familiar with. But you know, discussing again the different populations, the different needs, the different initiatives that are coming out. You know, how to best use our dollars once we get them. You know, what does that look like? And, you know, it looks like more of a wellness, holistic approach. So I am very hopeful, and you know, from where I started the field to where we're right now, we've gotten major gains.
Do you see, with all of the initiatives that you've been involved in, actual concrete improvements?
We've definitely we see a lot more people being involved in some of our efforts. We go to places that we don't usually go to, like, you know, churches or faith-based communities. They talk about mental health, maybe not the way we talk about mental health, but in a way that aligns with their community. People are interested to become teaching some of our classes and being the ambassadors of the work that we do. So for me, that really is a change, and I am hopeful. I mean, I would not be doing this work if I didn't believe that people can recover, right? Then I would probably find something else. But I do see it.
You've seen people recover.
Oh, yes.
I mean, it's one thing to talk about the collaboration and the sharing, and I guess the ultimate proof is in at the grassroots level, is in terms of people's lives.
Many stories.
Yeah.
Many stories of people said, you know, I have never heard of this. I had an issue. I thought I was alone, and they said, I want to change my career because I want to give back, and I become part of behavioral health.
So what would you say to the viewing audience in terms of the whole topic that we're talking about? You said you're hopeful.
I'm hopeful, and not only, and again, because I see what's being discussed and the initiatives, but also again some of the success stories, or many success stories that we have. Typically in the media, we see just very, I mean, heartbreaking stories, but we don't see the successes that I'm fortunate enough to see. I mean, just today, you know, and I know you're aware, I was with many patients throughout the day, and I can tell you, just going through my mind, how many of those were success stories.
Well, it's I have to thank you for sharing with us some of the things that aren't so hopeful and stressful. to letting us see that there are some things that are very, very hopeful, and that there are a lot of changes taking place in terms of the whole medical field that will enhance and expand healthcare throughout all communities. So thank you very, very much for sharing, and I'd certainly like to thank our viewers for watching. Until next time.